Bandaging is a critical first aid skill used to protect wounds, control bleeding, support injured areas, and prevent infection. Proper application of bandages ensures effective wound care, providing comfort and stability to the injured person. Among the numerous bandaging techniques, the cravat bandage on the forehead and the bandaging technique for chest injuries are specialized methods used to address specific injuries. These techniques require careful execution to maximize their effectiveness while minimizing risks. In this guide, we will explain these methods comprehensively, evaluate their advantages and disadvantages, and provide insights into their appropriate applications.
The cravat on the forehead bandaging technique is a triangular bandage folded into a cravat shape or a narrow strip and applied around the forehead. This method is commonly used to secure a dressing on the forehead or scalp, manage bleeding, or protect a wound from contamination. Procedure. Number 1. Prepare the bandage. Use a triangular bandage and fold it lengthwise into a cravat shape, about 2 to 3 inches wide. Number 2. Position the bandage. Place the center of the cravat over the dressing or wound on the forehead. Ensure the dressing fully covers the wound before applying the bandage. Third, wrap the ends. Bring the two ends of the cravat bandage around the head, just above the ears. Ensure they meet on the back of the head. Number 4. Tie the bandage. Secure the ends in a knot at the back of the head. Adjust the tension to ensure the bandage is snug but not too tight, as this may cause discomfort or restrict circulation. And lastly, check the application. Ensure the bandage is firmly holding the dressing in place without slipping. Verify that it does not obstruct the eyes or ears.
Injury in the chest bandaging technique. The bandaging technique for chest injuries is designed to secure a dressing over an open chest wound, control bleeding, and prevent further injury. This technique often includes the use of an occlusive dressing to prevent air from entering the chest cavity, which could cause a life-threatening condition known as pneumothorax. Here is the procedure. Number 1. Prepare the dressing and bandage. Use a sterile, non-adherent dressing to cover the wound. For an open chest wound, an occlusive dressing, example is plastic wrap or petroleum gauze, is preferred to seal the wound. Use a wide bandage or triangular bandage folded as a broad cravat to secure the dressing. Number 2. Apply the dressing. Place the dressing directly over the chest wound. If using an occlusive dressing, tape 3 sides of the dressing to create a flutter valve effect. This allows air to escape but prevents it from entering.
The cravat on the forehead bandaging technique has both advantages and disadvantages. Cravat on the forehead bandaging technique is simple and quick to apply. It provides secure dressing support for forehead or scalp wounds, and it is comfortable and minimally restrictive. However, it is limited to superficial injuries on the forehead or scalp. It is also ineffective for controlling severe bleeding without additional measures, and may slip if improperly tied or if the head moves frequently.
Advantages. Essential for managing open chest wounds and preventing pneumothorax. Prevents further contamination of the wound. Helps stabilize the injured area, reducing pain and discomfort. Disadvantages. Requires careful application to avoid compromising breathing. Improper sealing of an occlusive dressing may worsen the condition. May need frequent monitoring and adjustment, particularly during transport.
Bandaging techniques such as the cravat on the forehead and chest injury bandaging are essential tools in first aid. Each technique serves a specific purpose, addressing unique injury types while offering distinct advantages and limitations. Proper application requires precision, situational awareness, and adherence to best practices to maximize their effectiveness. Understanding the nuances of these methods enables first responders to provide critical care, potentially saving lives and improving outcomes in emergencies.